This is my continuing coverage of the health care bill. And in this particular segment, I'm going to continue the section where I was talking about what had to be enclosed in the 4-page document that you are presented to explain the health care coverage that you are trying to obtain, okay? This is let me picture to you this way. You're in a job. There's this open enrollment period. It usually occurs right over Christmas time, which is really a bad time to have open enrollment. In some jobs it occurs in the fall, which is much better, but in some jobs it occurs over Christmas, which is really bad. Okay? But you have this open enrollment period where you can choose whatever coverage you want to have for your health insurance. Alright? You'll have like 3 or 4 different companies you can choose from. And each one of them is going to provide you with a little booklet that's going to tell you what kind of coverage you can expect over the year if you decide to enroll in their health insurance program. Okay? And I discussed some of this stuff in my previous video, and now I'm going to continue the discussion in this video. Some of the things that they have to include in this 4-page coverage thing that they're going to give to you is if there are any exceptions, reductions, and limitations in coverage. In other words, things that these people, because remember, they have to cover certain things, but they don't have to cover other things. Not all health insurance providers are going to cover every single condition that you might ever get as you get older. So they have to say, okay, we have to cover these things, but if you get this particular disease, we're not going to cover it. Maybe we're not going to give you as much coverage as, say, some other health insurance, so on and so forth. Okay? And some things are still co-pay. Alright? Not everything. There are a lot of things that will no longer be co-pay, but there are some things in the health coverage that are going to be co-pay, and so they'll have to list your deductibles, your co-insurance, and your co-payment. Okay? They have to tell you about the renewability and continuation of your coverage. Okay? Saying, well, if you participate in this year, we may allow you to participate again next year, so on and so forth, or we may change the plan, so on and so forth. They have to tell you that in this 4-page booklet that they have to give to you. They have to also give you examples of the coverage. They have to give you typical scenarios that you may face along the way and show you how they would actually cover those particular instances, so you can get a generalized idea of how that particular health care plan will actually work. Then they have to list something called minimum essential coverage. And this is going to be a paragraph, well, not really a paragraph, it's going to be a bunch of paragraphs that are going to be added to, it's going to be called Chapter 48, Section 5000A of the Internal Revenue Code of 1986. So you have this Internal Revenue Code of 1986. Now you're going to have a Chapter 48, which has not been added yet, but it will be now that the health care bill has passed. And when you go to this Chapter 48, you go to Section 5000A, what you're going to find here are things that are the bare minimum that these health insurance providers have to cover from now on. One of them is the Medicare program under Part A of Title 18 of the Social Security Act. Now, I'm going to take the time here because, boy, I tell you what, they have got, this stuff is doozy, okay? So, I want you to hang on just a second, and in my next video, I'm going to show you this minimum, it's called a minimum, hang on just a second. Minimal essential coverage. And I'm going to cover minimum essential coverage in my next video, so stay tuned.